अस्सलाम वालेकुम मेरा नाम सैयद शुजात अली नकवी है। फोरम इंग्लिश में है तो मैं इंग्लिश में बात करूंगा आप लोगों से। What I've decided today is to present a talk on forgiveness, conditional and unconditional, in human mental health. I appreciate the hosts in inviting me, and I'm deeply appreciative of my dear colleague Dr. Afzal Javed for his kindness in asking me to deliver this lecture. Bismillahirrahmanirrahim. Laman sabra wa ghafrunna zalika laman azmul amur. Whoever is patient and forgives, verily that is among the matters of steadfast determination. Forgiveness is a complex neurocognitive and emotional process. Forgiveness has been a fundamental issue in many religious traditions. Forgiveness has been increasingly recognized as an important aspect of psychotherapy. A complete understanding of forgiveness requires knowledge of its underlying mechanism. Introduction. Forgiveness includes an understanding of the sense of self, a recognition of harm to self, and of revenge behavior. This requires a review of the forgiveness process and its phenomenology, evolutionary origins, neuropsychological mechanisms, and social mechanisms. So the aims and objectives of today's talk is to introduce neuroscience and neuropsychological concepts, which are increasingly being recognized in the whole field of human forgiveness and as it pertains in our practice of in the field of psychiatry, both in adult and in child and adolescent psychiatry as well. Clinical scenarios and challenges around forgiveness, a brief review of recent empirical research literature on the topic, a conceptual issue around apology, which is an essential part of forgiveness, spirituality and forgiveness, which cannot be ignored, and reflections on the role of forgiveness in the psychiatric clinical practice. The definition of forgiveness is quite unique and I think is multi-layered and multifactorial. Forgiveness is a non-verbal concept that cannot be adequately captured in words. We can best know what forgiveness is when we experience forgiving. Words can help to point in the right direction, though in particular clarify what forgiveness is not. Metaphors can also have a helpful function in providing understanding where words fail. It involves a process of dissolving feelings of anger, essentially, resentment and or hatred towards an individual who is perceived to have selfishly or maliciously done one deliberate harm. By means of the cultivation of some degree of compassion towards the offender and or the acceptance of such positive feelings should they happen to evolve naturally in the victim's experience. I am very fond of this metaphor by Stephen Hayes, who suggests that if you are in an unforgiveness state, then you are in a sense on a giant metaphorical hook. Next to you on that hook is the person who has hurt you. They got hooked after you and are closest to the barb. The hook is very painful. Wherever you go, the hook goes, and so does the offender. The only way you can get off the hook is if you allow the offender to get off the hook first. The cost of not allowing the offender off the hook is perhaps a lifetime of misery for the person in forgiveness. Let's talk a little bit about the neuroscience and neuropsychological concepts which have emerged in the past, I would say, a decade and a half in the field of forgiveness science, if I could use that word. First of all, the evolutionary concepts. In nature, conflicts arise as self-interested individuals compete over limited supplies of food, space, mating partners, social status, refuge from enemies, and other scarce resources. To resolve such conflicts, behavioral strategies for conflict resolution have been evolved and which enable them to repair the damage caused by conflict, restore peaceful contact, and preserve social relationships. The conspecific congress concept is a perceived non-hierarchical relationship between a given individual and the other conspecifics in the group. Conspecific congress is a type of balance. Hierarchical order is vertical. Conspecific congress is horizontal. That's the key point. We are all equal, at least since we are all human beings. Understanding conspecific congruence requires the left inferior parietal lobe, and I'll show you some specific spectroscopic MRI studies to support what I'm saying here, stating here, can be changed in a positive or negative way Positive change is a favor of kindness or with consequent obligation to return it in some way in order to balance the incongruous. Gift giving, charity, doing favors, pay it forward. Negative change is an injury or insult with the likely desire for revenge to restore balance. Insulting, lying, stealing, physical harm. Human conspecific congruence applies to individuals within the group, also applies to the world, resulting in a self-world congruence. Once congruence is negatively altered, the process of revenge or forgiveness can occur. There are only two ways to go. Either you go towards revenge or you go towards forgiveness. Once an injury occurs, what happens next? Like I said, there are only two options, revenge or forgiveness. Now, revenge is easier to understand than forgiveness, actually. An eye for an eye, lex talionis, exists in virtually all cultures. How does the forgiveness process begin? It begins with a sense of self, an injury to self, cognitive and affective processing, reconciled sense of self, and outward forgiveness behavior. So the cognitive and affective processing required to rectify incongruency once injury is realized, many possible approaches specific to each individual. For example, there can be a spiritual approach, which is much more known to all of us. Humanistic approach, a rationalistic approach, you can read the slide yourself, an empathic approach, and an apologetic approach. Approaches are also specific to conditions, age, gender, socioeconomic factors, dare I say, cultural and societal factors, and previous history of injury, and ultimately leading to a reconciled self. A reconciled self is a new understanding of self in relation to the world, new understanding of the conspecific congruence, new emotional set point that has resolved original injury, and generally associated with positive emotions, although can potentially be negative as well. So behavioral responses are new understanding of conspecific congruence is associated with positive feelings and decreased anger, resentment. Positive feelings can be translated outwardly in the form of forgiveness, includes how perpetrator is treated as part of the reconciled self. A complex diagram, I don't want to go too much in detail, but if you take it from stages of self to injury to self and injured self, cognitive effectual processing, reconciled self, and forgiveness, specific neurophysiological processes are going on in specific areas of the brain. For example, the self mediated by the parietal, frontal, and temporal lobes with input from the sensory system and hippocampus from memory. Injury to self by sensory motor system, I think it's well known to all of you. Injured self is mediated by the limbic system with negative effect, hypothalamus, sympathetic nervous system. And you can go down the grid on the right-hand side, matching the processes of the stages of forgiveness as they evolve. So clinical scenarios and challenges around forgiveness. Neuroimaging of the state of phase of forgiveness, how clear and vivid was the picture of your... So one of the studies which we have done in spectroscopic, I was part of this actually, in a spectroscopic MRI, where a neuroimaging of the state of the phase of forgiveness was actually translated to the participants. How clear and vivid was the picture of your imagined scene? How angry and frustrated were you in the imagined context? How easily could you imagine to not forgive and to think about revenge? How easily could you imagine forgiving? How much did you feel better after forgiving? And here it is, an activation pattern was elicited during the response conditions compared to pre-hurtful and hurtful conditions. The figure shows quite clearly, I wish I could point it out on the slides, but I cannot, that brain areas active during forgiveness and unforgiveness as compared to pre-hurtful and hurtful scenarios. And you can map out the statistical parametric maps of activation as visualized on a brain template. In fact, inferior frontal gyrus is the one ACC, PCC, and a pre-C at the back as well are the areas which are involved. So in the state of forgiveness, this is a complex slide, I know. I'm translating the image which I showed you previously into a neurophysiological mapping, and you can see the areas which and you can read the slide yourself, where in the forgiveness state, certain cascade of electrophysiological events are transpiring versus in a state of unforgiveness. And I think the important point to make over here is that the posterior cingulate cortex and the dorsolateral prefrontal cortex play a very critical role over here in terms of the stimulation. Complex research, still evolving in its infancy, but the work is being done to translate both of these in some shape and form. So bestowing forgiveness, let's get into clinical, the bread and butter, the work which we do as psychiatrists. In order to understand forgiving, one has to take into account the victim, the perpetrator, and the trauma that has been inflicted upon the former. In clinical as well as social situations of adult life, three factors seem important in making it possible to advance from a traumatized victimhood to forgiveness. And these are, as I mentioned before, or trying to explain the science of this whole concept: revenge, reparation, and reconsideration, the three R's. To the students in the audience, revenge, reparation, reconsideration. In tandem, these three factors, revenge, reparation, and reconsideration, improve reality testing, facilitate mourning of the earlier injustices, enhance ownership of one's own destructiveness, permit the capacity for the concern for the opponent, and allow mature forgiveness to emerge and consolidate. And while you're doing therapy in any shape and form, and by the way, the revenge, reparation, reconsideration applies to a variety of different circumstances. And of course, I'll be happy to take some questions in the end once the audience seeks to do so. Seeking forgiveness. The wish to be forgiven implies that the subject has become cognizant of having done something hurtful, an act of omission or commission, an actual or psychic reality, or both, towards another individual. It also implies that the latter is significant enough for the perpetrator to want to restore the pre-existing relationship with him or her. Seeking forgiveness, therefore, emanates from not only a capacity for remorse, but from having insight in one's feeling for one's victim. Psychopathologically, there are a variety of scenarios which I want to go into a little bit more in detail. Syndromes involving forgiveness include inability to forgive, premature forgiveness, excessive forgiveness, pseudo-forgiveness, relentless forgiveness seeking, inability to accept forgiveness, inability to seek forgiveness, imbalance between capacities for self-forgiveness and forgiveness towards others. And the heart of this work is from psychoanalytic background. This is not cognitive behavior. This is not interpersonal psychotherapy. This is not dialectical behavior therapy. This domain is quite this research, this body of work in the past 50, 60 years has unparalleled gone on in a psychoanalytic work. One of the persons whom you may be aware of, Professor Salman Akhtar, who is the son of Janisar Akhtar and one of my mentors actually, and a brother of Javed Akhtar, the famous playwright in India. He is the emeritus professor of psychiatry in the University of Pennsylvania, Jefferson Medical College in Pennsylvania. And he has done a phenomenal amount of work analytically on this domain. All right, going to psychopathology briefly, inability to forgive. They hold on to grudge and are given to chronic hatred, though they might not be overtly vindictive. Premature forgiveness. A second syndrome is characterized by individuals who seem too readily prepared to forgive and forget injuries inflicted upon them. These are all pathological domains of either being an extreme of the whole concept of forgiveness. Excessive forgiveness is seen in masochistic individuals that repeatedly forgive traumas inflicted upon them by their tormentors and never seem to learn from experience. Relentless forgiveness seeking. Some individuals are relentlessly apologetic about ordinary errors of daily life. They betray a heavy burden of unconscious guilt. Apologizing for their actions does not relieve them of the prohibited and morally repugnant, hostile, and sexual intentions that lurk in their unconscious. Inability to accept forgiveness. Closely akin to those who repeatedly apologize are individuals who remain tormented, often for months and years, despite having been forgiven by others. They seem unable to accept pardon and continue to suffer from remorse and its depressive and persecutory consequences. Inability to seek forgiveness. Individuals who lack empathy. And you see that more in the broader concept of autistic syndromes, Asperger's disorder, which has been removed from DSM-5 recently. The lack of empathy is the key. Simon Baron-Cohen in Cambridge has written a lot about that. These are individuals who lack empathy, but others often do not seek forgiveness. They seem oblivious to the harm and injuries they have caused to others. Such oblivion is often the result of severe superego defects and the associated incapacity for remorse. Imbalances in forgiving others versus forgiving self. Narcissistic, paranoid, and antisocial individuals readily absorb themselves of responsibility of having caused any harm. And I'm sure in the larger political arena in the world, in the past few years, you've come across such examples. Masochistic individuals are prone to do just the opposite. They forgive others, but continue to punish themselves relentlessly. So the clinical implications are that concerns around forgiveness surface in the course of psychiatric treatment in many ways. With severely traumatized individuals, PTSD is the heart and soul. And not only PTSD, a colossal loss or calamity. In the field of child adolescent psychiatry, I see that every day in facing parents who have been inflicted with the defined genetic syndromes in the children, and at some level, that unconditional forgiveness is hard to achieve. And I can go a little bit more into that as we move along. With severely traumatized individuals, forgiving or not forgiving those who have hurt them, and the transferential reactivation of such objects sooner or later occupies the center stage of clinical dialogue. With individuals who suffer from remorse over real or imagined injuries caused to others being forgiven by actual external figures, and in transference, the psychiatrist becomes a concern. Salman Akhtar has written a lot about that. Individuals who have suffered from severe childhood, for example, sexual abuse, that's what I see as child and adolescent psychiatrist. Physical violence and cruelty, massive and sustained neglect, bring with them an internal world rife with split self and object representations with the predominance of hate over love and of malice over concern for their objects. So these are some of very summarized points to keep in the back as you go along. So treatment implications are, again, revenge, reparation, reconsideration. Working in tandem can facilitate mourning of trauma, permit acknowledgement of one's own destructiveness, release the capacity for concern for the opponent, and allow forgiveness to emerge. So revenge is taken by the patient, one of the treatment implications in the scenario and therapy, as and when it happens, in the form of relentless sadistic assaults on the therapist. Reparation is available in the patient in the form of therapist lasting empathy and devotion that despite the patient's attacks upon it. Winnicott in 71, who was himself a very pediatrician essentially, but turned out to be an icon in the field of child adolescent psychiatry from the United Kingdom, has written a lot about the whole concept of reparation. And reconsideration, which is a critical element, results from recontextualization and revision of childhood memories. Negative images of early caretakers now come to be supplanted with recall of hitherto repressed positive interactions with them as well. I'm not going to spend too much time on empirical research, but let you know that there is some genetic research going on right now. The South Koreans seem to be ahead in the field. DRD42 repeat allele, the comp polymorphism had no significant relationship, as you can read in the slide as well, and the possible relationship between anger expression styles and the forgiveness traits and the dopaminergic dysfunction. That's why in the ADHD psychopathology, I think I'm jumping too much, and the whole release of the dopamine in the prefrontal cortex, these things are being very heavily studied right now as I speak. Forgiveness, feeling connected to others, and well-being, two logged studies, is been the Catherine work in personality social psychology in 2018 has been talked about. Unraveling the role of forgiveness in family relationship in a family of two parents and one child is a good study. Meditation lowers stress and supports forgiveness among college students, a randomized control trial. This was the American College of Health from April 2008, suggesting that meditation-based stress management practices reduce stress and enhance forgiveness among college undergraduates. This is a very good study. Hamza Raz and Avital Lofer, both sitting on both sides, one Palestinian, one Jew in Israel, have done some remarkable work in an era spanning about 15 odd years and worth the perusal, looking at the whole ethos of revenge among Israeli, Palestinian, and Jewish adolescents. Israeli Palestinians displayed more post-traumatic symptoms, higher levels of objective exposure to terror, more negative life events, lower ability to forgive, and a higher need for vengeance than their Jewish counterparts. Both groups had similar fear levels. Israeli Palestinians expressed more favorable attitudes towards peace. This is just one outtake over there, but the research is ongoing and it's worth your review. Age differences in forgiveness, not a surprise. With increasing age, forgiveness comes a little bit more au natural than not. So I'm just going to end up on this a little bit briefly. The Stanford Forgiveness Project by Fred Luskin, which resulted in a book as well. It was a PhD thesis, series of research projects that investigate the effectiveness of specific forgiveness methodology. It's a dissertation study which really exploded into a wide body of work. And you can read the slide yourself because of paucity of time. And it started with 259 community dwelling adults in the San Francisco Bay Area. Average age was 41. For 1.5 months after the 6-week, 90-minute session forgiveness training ended. And cut the long story short, 70% decrease in feelings of hurt, 13% reduction in long-term experience of anger, 20% reduction in physical symptoms. And you can read the rest of the slide in the bottom half. I think where this took off like a meteor, it was when, in his genius, he launched the Hope 1 and Hope 2 project way back in 1990s and early 2000, and picked up the catastrophe in Northern Ireland and picked up Catholics and Protestants who had an immediate family member murdered. They were basically mothers, actually, started in this whole strategy in that. And as the last paragraph tells you quite clearly, these were not taking antidepressants. They were not in CBT. The response was quite profound. In a very small n, by the way, Hope 1 resulted in Hope 2. Again, he flew in these individuals with a massive loss, a mixture of Catholic and Protestants, and again showed a tremendous response in healing and resolution of feelings, which were quite strong and quite destructive, so to speak. And basically went on to work with American Express in the United States of America. Once you clearly show, as you can see over here, an 18.3% rise in gross sales, a 25% reduction in stress, he got a lot of funding, so to speak, as well. So it's a series of projects which Fred Luskin has done. And essentially, there are 9 steps which I want to go through. Know exactly how you feel about what happened and be able to articulate what about the situation is not okay. Then tell a trusted couple of people about your experience. The 9 steps of Fred Luskin may be clinical pearls in your work. Make a commitment to yourself to do what you have to do to feel better. Forgiveness is for you and not for anyone else. Number 3, forgiveness does not necessarily mean reconciliation with the person that hurt you or condoning of their action. What you are after is to find peace. Forgiveness can be defined as the peace and understanding that come from blaming that which has hurt you less, taking the life experience less personally, and changing your grievance story. 4, get the right perspective of what is happening. Recognize that your primary distress is coming from the hurt, feelings, thoughts, and physical upset you are suffering now, not what offended you or hurt you 2 minutes or 10 years ago. Forgiveness helps to heal those hurt feelings. That's a critical point. 5, at the moment you feel upset, practice a simple stress management technique to soothe body's flight or fight response. Give an expecting things from other people. Give up expecting from other people or your life that they do not choose to give you. Recognize the unenforceable rule you have for your health or for you, or how you or other people must behave. Remind yourself that you can hope for health, love, peace, and prosperity and work hard to get them. Put your energy into looking another way to get your positive goals met, then through the experience that has hurt you, instead of mentally replaying your hurt, seeking out new ways to get what you want. Remember that a life well lived is your best revenge. And I'll repeat it. Remember that a life well lived is your best revenge. Again, that revenge, reparation, and reconciliation. I think that these are important parameters which I talked about a few minutes ago. Instead of focusing on how your wounded feelings and thereby giving the person who caused you pain power over you, learn to look for the love, beauty, and kindness around you. Forgiveness is about personal power. Amend your grievance story to remind you of the heroic choice to forgive. And these 9 clinical pearls by Fred Luskin can be used in clinical parameters by anyone. So in summary, future direction in forgiveness research is forgiveness is a complex process, difficult to measure in acute or chronic setting. Brain imaging studies during active forgiving are now coming up in the field with some very profound results, especially in the prefrontal cortex, to be honest. Predisposition to forgiveness is psychological, imaging, and genetics. That's where we are doing a lot of research right now. And other physiological measures can be hormone as well. Just a word about apology, and I'm going to stop over here because of the paucity of time. Cannot go, but I think this definition of apology is absolutely sacrosanct. An apology, no matter how sincere and effective, does not and cannot undo what has been done. And yet, in a mysterious way, sincere apology, by the way, a real apology, by the way, and according to its own logic, this is precisely what it manages to do. But tavukas consists of a guilty party taking responsibility for its action in a heartfelt and truly remorseful way. Successful apology can begin to heal deep psychological injuries. Without apology, people stay locked in emotional situations that cause conflict. And one of the great examples in the political arena is an example of this man who, the moment he came out after being condemned and after being jailed and after being thrown blankets of tuberculosis to eliminate him, and started by saying, I have done something wrong. And knowing what's happening in that part of the world these days, and knowing during his tenure, nothing of that similar thing happened, I think goes to the genius and the wisdom of this man as well. And I will pretty much end above that. And just to end on this last slide, the principle of true apology. A true apology does not include the word but. I'm sorry, but automatically cancels out an apology and nearly always includes a criticism or excuse. A true apology keeps the focus on your actions and not on the other person's response. For example, I'm sorry that you felt hurt by what I said at the party last night. It's not an apology. Try instead, I'm sorry about what I said at the party last night. It was insensitive and uncalled for. Own your behavior and apologize for it. A true apology does not overdo. It stays focused on acknowledging the feelings of the hurt party without overshadowing them with your own pain. A true apology doesn't get caught up in who's to blame or who started it. Maybe you are only 14% to blame and maybe the other person provoked you. It can still help to simply say, I'm sorry for my part in this. I'm sorry for my part in this. A true apology needs to be backed by corrective action. If your sister mentions she's paid for your last few dinners together, apologize and let her know that you will plan to pay for the next few. A true apology requires that you do your best to avoid a repeat performance. Obviously, it doesn't help to apologize with a grand flourish and then continue the very behavior you apologize for. Passionate expression of remorse are empty if you don't put sincere efforts into ensuring that there is no repeat performance. A true apology should not serve to silence another person. I said I'm sorry at least 10 times, so why are you still bringing up the affair? Nor should an apology be used as a quick way to get yourself out of a difficult conversation or dispute. A true apology should not be offered to make you feel better if it risks making the hurt party feel worse. Not all apologies are welcome. Making amends may be part of your healing process, but find another way to heal if the other person doesn't want to hear from you. A true apology recognizes when I'm sorry is not enough. A serious hurt or betrayal requires repair work over time to restore trust. I will end on that, and then hopefully, if I'm present in the presentation, the time when this is being presented, I would love to take any question and answers. Thank you so much for your kind patience.